In the buried lead, if you were unlucky enough to get it, typically you only have about a 10% chance of surviving. The Ebola virus, one of nature's most efficient killers, it is exploding. The relief group Doctors Without Borders says the epidemic is so out of control they can no longer send teams to new outbreak sites. It's been growing since March, which is at least 326 deaths. That's so far. Our chief medical correspondent, Dr. Sanjay Gupta, visited the region of the outbreak in Western Africa recently. So, Sanjay, what makes this so unprecedented, which is the word that relief workers are using?
Well, I think it's really the scope of this. When you've talked about Ebola in the past, typically it was sort of relegated to a small village within some particular part of the jungle. But now you take a look at the map and you see just how far this has spread. Where we were in Guinea, I should point out as well, John, we found that the virus was making its way into big cities, including Conakry, which is the capital of Guinea. That's a city of 2 million people. It has an international airport. And I think that's part of the reason there's been this widespread viral sort of load in many countries. There's also, I'll tell you, John, just being over there, there's still a mistrust of many of the medical workers trying to provide care. And I think as a result, people get diagnosed late and may transmit this even more so before, they actually get some help.
Doctors Without Borders says they're out of resources. Yeah. You were inside those isolation areas where that group is working in Guinea. Can you describe the scene for us? What was the environment like? Was that the mistrust you were talking about?
That was some of the mistrust, but I will tell you, and this is the type of story which, it's very different in some ways being on the ground. First of all, when you talk about Ebola, it's not that it's particularly contagious, but it is highly infectious. And what that means is that while it doesn't spread easily from person to person, only a small amount can get somebody sick. And that's why you see these essentially moon suits that people are wearing. You have to protect every square inch of your skin. And that's just very labor intensive. There's a high turnover among the medical staff that works in those settings. Those suits and some of the resources you see there being used, you start to run out of those things after a time. It's a relatively small area where it was confined, where they were actually taking care of these patients, but they've had to expand those facilities as they've had more and more patients.
We say it's relatively confined, Sanjay, but at the same time we use words like outbreak and we use words like extremely deadly. Can it spread beyond that? Is that something that other people in other areas, other parts of the world need to worry about?
Here's how I would answer that, John. It's something that we thought about a lot, as you might imagine, being over there. My guess is that at some point you have a virus here that has what's known as an incubation period between 2 and 21 days. That means after exposure, you can not have any symptoms, not be sick for up to 21 days. You can get on an airplane, you can fly anywhere around the world. It is possible you're going to see people show up in different parts of the world who may have been exposed to the Ebola virus. One thing that's very important to point out, though, and I think this should provide a little bit of comfort, is that before people start to spread this virus to other people, they are very sick themselves. They are not up walking around. They're not at that time flying. They're down in bed. They can barely get up. And that's why family members and healthcare workers are always the most likely people to get the virus, to have the virus spread to them. So I think we're going to hear about a case somewhere else around the world. But I think the idea that it causes another outbreak somewhere else, I think is very, very unlikely.
It's a situation, though, that does demand attention. Sanjay Gupta, thank you so much for shining the spotlight on it for us. Appreciate it.
Thanks, John.
Coming up.